How do you stop acid reflux on Ozempic? Well, 15 million Americans today are on these sort of GLP-1 medications like Wegovy, Ozempic, Trulicity. And while heartburn isn't an official symptom of these medications, tons of people have swarmed to social media and reported to their doctors of dealing with these kind of symptoms. So if you have heartburn or regurgitation or issues that are disrupting your sleep or just the way you go from day-to-day life since starting Ozempic, then this could definitely be the answer and you're not alone. In this video, I'll briefly explain why acid reflux happens on Ozempic, and of course what you can do about it, including what over-the-counter medications are safe to take with Ozempic and GLP-1 medications, what sort of natural lifestyle things can you do to manage the symptoms, and how you can go for the root cause to resolve the problem long-term. Now really quick, acid reflux happens when stomach contents flow backwards into the esophagus. And if you can imagine it this way with my prop, if this bottle was your esophagus and this balloon was your stomach, there's supposed to be a valve here that separates the two when you eat. But when you have acid reflux, the juices are coming back up in the esophagus, bathing your tender walls and tissues in there with really strong stomach acid. And so that causes inflammation, irritation, and of course the trademark heartburn and other acid reflux symptoms. So what happens when Ozempic enters the picture? Well, Ozempic and other GLP-1 medications like it delay stomach emptying, which just means that stomach contents stay in the stomach for longer than they otherwise would. And this can be really beneficial for things like weight loss because, the longer that the food stays in the stomach, the longer that you feel full and the less appetite you have overall. So it suppresses appetite in that way. The downside is the longer that the food stays in the stomach, the greater chance that it refluxes back into the esophagus, causing the heartburn, regurgitation, these sorts of things. Now, this isn't really a new phenomenon. We already know that foods that take longer to digest, medications that also delay gastric emptying, or even other health issues that slow down the motility of food through the stomach, all increase the risk for acid reflux and are known predictors of acid reflux. So it's actually quite surprising that the trials for Ozempic and similar medications didn't report acid reflux as a side effect. So how do you stop acid reflux on Ozempic? Well, the guidance to manage acid reflux while on Ozempic is actually the exact same as if you weren't on Ozempic. So just treat it like regular acid reflux. There's 5 different things you can do. First of all, you can avoid food triggers. You can make behavioral modifications. You can take medications, of course. You can use some natural remedies, and you can also strengthen the valve to stop that acid reflux from entering the esophagus. And so I'll do my best to cover those 5 things. If you want more details on those, you can always use the link in the description, grab my ultimate guide for acid reflux. That's where I can break it down in more detail. So avoid these food triggers. I put together a tier list for you guys to help organize and prioritize which foods you should avoid. I've built this tier list based on 2 things. First of all the research and journals and scientific evidence I could find on each food, but also my own in-practice experience helping my clients deal with digestive issues just like acid reflux. And so this is kind of exactly what I would tell them. If you were to walk into my office right now with acid reflux, what I would tell you to start avoiding and what I'd tell you to start adding. And the first thing that you should definitely avoid, there's no dispute in the research or literature about these things. They are definitely causes of acid reflux. Those are your fatty foods, your oily foods, your fried foods, fast food. These sorts of things relax the sphincter when you eat them, so it allows for more reflux. I'd implicate cheese in that as well, and other fatty foods like it. Take your pick. Then there's carbonated beverages. Those build pressure inside the stomach and are going to put pressure on that valve, and so increase your acid reflux. So definitely avoid those and cut those down if you want to head in the right direction. And then alcohol has also been shown to definitely weaken the sphincter as well. Common triggers. These aren't in the definitely category because basically, the evidence that we have for them is based on survey information of people self-reporting their food triggers. And so basically there's a lot of evidence to show a lot of people have these triggers, but there's I wouldn't say there's but there's a lot of conflicting evidence on whether or how these things actually cause acid reflux. So it's kind of up in the air and it's person to person. You might have all these triggers, you might have none of the triggers. And so you really have to kind of piece and tell, but these will give you a list of things that you should be aware of that might be causing things. So you might try pulling them out and testing, yourself. Those things include coffee, tea, chocolate, spicy foods, tomato-based products like tomato sauces and salsa, allium vegetables like onions, leeks, garlic, mint, especially peppermint, as well as spearmint, and then citrus, like limes, pineapples, grapefruit, oranges, those sorts of things. Now, there's also things that you can use to potentially manage the symptoms. These are things that are chemical buffers that kind of neutralize the acid. And the only ones that you can more count on are the non-fat milk and the non-fat yogurt. Those are things that I would actually say you might actually try. Now be aware, because they also might be triggers themselves. So use at your own discretion. And I would usually use it as kind of a short-term thing to manage symptoms, not really as part of a long-term plan. And these are the things to definitely add. These are either watery fruits or vegetables that neutralize acid by kind of diluting it. And those things would be things like celery, watermelon, cucumbers. I'm sure there's other watery fruits and vegetables you can think of that you could try. And then, of course, things that just generally help digestion, fiber-based stuff like whole fruits, whole vegetables, whole grains, and then things like beans, legumes, all great stuff are going to facilitate digestion and help you with acid reflux. The last thing I'd stress about food triggers is you have to be aware that these things can happen also in combination. So you might have a food trigger that only happens when you have citrus and something else, right? It can also be dose related. So it could be the difference between, having a little dab of hot sauce versus, a whole spicy meal, So those might cause triggers differently. And so it's really important to keep a food log that tracks not only what you ate, but what food triggers you had, how much of them you had, and then events that happen before and after. So stress, sleep, these sorts of things, kind of your general emotional state as well. Those are really important to track alongside your food triggers so you can get a full picture. Behavior modifications. These are little tweaks to things you do on a daily basis that can help you manage the symptoms of acid reflux. I'm just going to list them off and then I'll explain why they're the case. First of all, you can eat more frequent and smaller meals. You can also wear looser clothing. You can avoid eating within 3 to 4 hours of going to bed. You can elevate your bed or body during sleep. You can avoid exercising on a full stomach. You can drink more water because that dilutes the acid, and you can also reduce or stop drinking carbonated beverages. We kind of already talked about that. But basically, anytime that you lie down with contents in your stomach, you basically encourage reflux because gravity is no longer holding that food down. So don't just, prop your head up. Make sure that your whole torso is angled up so that gravity can help you stop that acid reflux. And then trying to go to bed on an empty stomach is also going to help that because you're not going to have contents in your stomach to begin with. So that makes sense. Also, anything that builds pressure on the abdomen, so that's why wearing tighter clothes can cause more acid reflux. Eating bigger meals is going to stretch the stomach and cause it to have more pressure as well. And so that's why those things are known to happen. Medications. So there's 3 classes of acid reflux medications. According to Ozempic's clinical trials, none of them interfere with Ozempic. But that said, definitely consult your doctor before starting these, especially since you might be on other medications that do interact with these acid reflux medications. Now, all these medicines are available over the counter in at least regular doses. If you want to get higher doses or special ones, you can go get prescription. But the first group is antacids, and these are chemical buffers that help counteract the acid in your stomach so that it's not as irritating or damaging to the esophagus. And you might recognize brand names like Tums, Alka-Seltzer, Pepto-Bismol, Rolaids, or Mylanta. Those sorts of medications are antacids. The second group of medications is the H2 blockers. And H2 blockers are kind of the old generation of acid suppressors, and they work by reducing the production of acid in your stomach. Brand names you might recognize are things like Axid, Pepcid, Tagamet, these sorts of things. The third group of acid reflux medications are proton pump inhibitors, or PPIs. And this is kind of like the newer generation of acid reflux medication. They work also by suppressing the acid production in the stomach, And some names that you would recognize are Prilosec, Nexium, Protonix, these sorts of things. Now, for short-term use and symptom management, these medicines are very effective. However, when used in a prolonged long-term use setting, they have a lot of drawbacks. Weaker stomach acid does a number of things. For instance, it makes it harder for your body to break down and absorb certain nutrients, things like calcium, folic acid, B12, and more. So there's concerns about that. Long-term use can also be associated with increased bone fracture, potentially due to poor nutrient absorption as well. There's also a documented rebound effect. So when stopping some of these meds after prolonged use, it can make it really difficult to actually get off the medication altogether. It also might reduce your natural germ-killing ability. That acid doesn't just digest food, it also kills a lot of bacteria that come down alongside the food that you eat. So it's been associated with increased C. diff infections, as well as more cases of small intestine bacterial overgrowth, or SIBO. So if I was using them for longer than 4 to 8 weeks, I would have a discussion with my doctor, but of course, please use your own judgment in your case. Now, there's some medicines you should avoid. Of course, anything that interacts with Ozempic or any of the GLP-1 medications that you're taking, you should avoid those. But also, just for acid reflux in general, you should avoid any non-steroidal anti-inflammatory drug, which is things like ibuprofen or aspirin. Those have been shown to make acid reflux worse. And then there's a full list of medicines that I'll put in the description, because there's kind of a ton of them that can potentially cause acid reflux as a side effect. So I'll put that list in the description. Just click the link, you'll be able to find it. If you prefer herbal approaches, there's some natural remedies you might try. Now, there's not a ton of research verifying or confirming that these actually help, but if they were to work for you, it could be a huge win. Some of these things include just general digestive agents like ginger, chamomile. Both have been known to help and have digestive properties. Turmeric is very anti-inflammatory, and so as long as it doesn't trigger you, it can be really helpful to kind of tame any heartburn that you're dealing with. And then licorice. It's been known for digestive improving properties, but also to strengthen the mucus lining of the esophagus. You probably want to go for the deglycyrrhizated, I think I got that right, version, because the one that isn't deglycyrrhizated can potentially raise your blood pressure. So those are some natural remedies you could try. Now, finally, you can move to fix the root cause. And I know it might seem like your Ozempic caused your acid reflux, and in many cases it did, but the deeper root cause is that the stomach valve that stops the reflux from happening, it just isn't doing its job, it's failing. And so it may be that the medication caused a change that exposed a reflux problem in development. We know this is a lifestyle disease. There are tons of risk factors that weaken that valve over time. And so it might just be that case that this was the straw that broke the camel's back in your case. And so it behooves me to talk about how to strengthen that, because first of all, it's not talked about enough. And it's an important part in my students' success in reversing acid reflux. But also, if you think about it, if your stomach valve just worked better, you'd be able to take Ozempic without having the reflux. You'd probably be less dependent on reflux medications to manage the symptoms, and you wouldn't have to worry so much about avoiding food triggers. You'd be a lot more flexible in that department. Now, tips to strengthen your valve. Now, these are all some kind of longer term things to work on, because if you imagine, most of these risk factors have built up over a long period of time. So it's not something you can really fix overnight, but there are some things that you can start changing. First of all, shed any excess weight. Having excess weight just puts more pressure on the stomach, and then that pressure then weakens the stomach valve that stops acid reflux. And so if you're already taking Ozempic to lose weight, or you're working on that yourself, you're already on the right path. So good stuff there. Reduce or stop drinking alcohol. We talked a little bit about that. Weakens the sphincter, and so cut that out. One thing that we didn't talk about is reducing or stopping smoking. Smokers have definitively weaker sphincters, stomach valves, than people that don't smoke. This is because the coughing and deep inhales can put more pressure over time. And then the chemicals, of course, in smoking weaken that sphincter over time. So reducing or cutting that out is going to really help your acid reflux if that's you. Make sure to resolve other digestive issues. It's crazy how much overlap acid reflux has with other digestive problems. Maybe that's surprising, maybe that's not surprising, but if you have constipation or SIBO or bloating or IBS or diarrhea, resolving those things is going to really help go a long way to resolving your acid reflux. So consider that. Along those lines, stress. Stress is a huge indicator of acid reflux and a trigger as well. One way is physically. If you carry your stress in your abdomen, you know how some people will clench their jaw when they're stressed or they have a tight back or neck. If you hold your stress in your abdomen, anytime you get stressed, that pressure increases on the stomach and you're gonna have more reflux episodes. So working on that stress that way, but also in terms of the gut-brain axis. This is just the bidirectional connection between your stomach and digestive organs and your brain. Basically, emotions that you experience in your mind, frustration, anger, depression, even happiness, influence how your digestive system operates and whether it functions faster or slower or better or worse. And so regulating those emotions is going to really help you manage acid reflux. And so considering that as well into the equation is really important, especially when you're food logging. And the last one to consider is any structural issues you might have, especially like hiatal hernia or hernias in general. These kind of disrupt the supportive structure for that valve. And so resolving those things is going to help with acid reflux in most cases. So there you have it. That's how you stop acid reflux while on Ozempic. You can manage the symptoms by avoiding food triggers, making behavior modifications, consider medication or herbal remedies. Or you can go for the long-term fix to fully stop acid reflux. And if that's the case, if you want to stop it long-term, you'll probably have to go a little bit deeper into some of the things that we already talked about. And so if this was helpful for you, please like and subscribe. That way you get more helpful content on these sorts of health subjects. You can also go into the link in the description and download my ultimate guide for acid reflux. That's going to have just a more detailed breakdown and a more detailed plan and blueprint as well to approach it with. Hopefully that's helpful to you, and hopefully this video was helpful. Thanks for joining us, and we'll see you in the next one.